Healthy sexuality, a resource. Many people are shy when it comes to talking about sex, even with a long-term partner. People may avoid talking about it because they feel vulnerable in exposing thoughts of such a personal and sensitive nature. Often what is feared is the threat of feeling embarrassed, ridiculed, or rejected. Yet, however awkward initially, talking about sex and sexuality offers the best way to demystify and normalize it. But why should we talk about sex? Accessing information and talking about sex and sexuality may provide young people such as yourself with the knowledge, understanding, and the skills needed to make informed decisions. It's during this phase of life that you begin to form long-term behavioral patterns that will significantly affect your health and well-being later on in life. What are our reasons for having sex? It depends who you ask, really. According to evolutionary theorists, asking why people have sex is almost like asking why people eat. Our brains are designed to motivate us towards sexual behavior. In other words, we are programmed to pursue sex. It promotes the continuation of our species. Cultural theorists, however, tend to focus on the cultural and personal reasons people have or avoid sex. Cultures differed markedly in what's considered to be appropriate reasons for having or avoiding sex. There can be no doubt about the fact that sex is meaningful. It may represent the pursuit of a practical goal such as reproduction, physical reasons such as stress relief and pleasure, or as an act of emotional bonding and the expression of love. For some, it allows for the expression and enactment of certain needs related to things like self-esteem, dependency needs, power, or belonging. While these examples speak to the fulfillment of physical and emotional needs, sex may at times be an avenue through which to pursue material and social needs too. Sex and sexuality are normal, positive, and lifelong aspects of health and well-being. The World Health Organization defines sexual health as a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So we could say that the achievement of sexual health and well-being depends on access to comprehensive, good quality information about sex and sexuality, knowledge about the risks faced and one's vulnerability to adverse consequences of unprotected sex, access to sexual health care, and living in an environment that affirms and promotes sexual health. In other words, to put it simply, what it takes for me and you to be sexually healthy is being comfortable with our own bodies and sexuality, being able to talk effectively with peers, family, and partners, knowing your body and how it functions, understanding the risks, responsibilities, and consequences of sexual behavior, being able to recognize risks and possible ways to reduce them, knowing how to access and use healthcare services and information, being able to set boundaries when it comes to sex and sexual relationships, the ability to act responsibly according to your personal values, and the ability to form and maintain healthy relationships. Let's look at some useful terms and definitions in speaking about sex and sexuality. Sex is a label, male or female, that you're assigned by a doctor at birth based on the genitals you're born with and the chromosomes you have. It's something that goes on your birth certificate. Intersex or intersexuality describes people born with physical sex characteristics that do not fit typical binary notions of male or female bodies. Gender. Gender refers to behavioral, cultural, and psychological characteristics associated with femaleness or maleness. Gender is complex. It's a social and legal status and a set of expectations from society about behavior, characteristics, and thoughts. Each culture has standards about the way that people should behave based on their gender. This is also generally male or female, but instead of being about body parts, it's more about how you're expected to act because of your sex. Gender identity refers to a person's internal sense of being male, female, or somewhere else on the gender spectrum. Gender identity is how you feel inside and how you express your gender through clothing, behavior, and your personal appearance. It's a feeling that begins very early in life. Transgender. This term can be synonymous with gender nonconforming. Some use this term to refer to individuals with gender identities that are the opposite of their assigned gender. Being transgender is distinct from your sexual orientation. Let's look a bit more closely at sexual orientation. Sexual orientation refers to an individual's pattern of physical and emotional attraction and arousal towards other people. Homosexuality is a type of sexual orientation. Homosexuality is an enduring pattern of emotional, romantic, and/or sexual attraction to people of the same sex as you. Heterosexuality is also a sexual orientation. It implies an enduring pattern of emotional, romantic, and/or sexual attraction to people of the opposite sex to you. Bisexuality describes a pattern of romantic attraction, sexual attraction, or sexual behavior towards both males and females, or to more than one sex or gender. Asexuality is also a sexual orientation, like being gay or straight. It's different from celibacy or abstinence. Asexuality describes a lack of sexual attraction. Asexual people may experience romantic attraction, but they do not feel the urge to act on these feelings sexually. GLBTIQ is a term that aims to be inclusive of all alternative sexualities. It refers to these forms of sexuality as a community. In adolescence, our romantic and sexual attractions tend to intensify. We begin to learn how to manage and express our feelings and desires, and how to negotiate new romantic relationships. As the teen years progress, this exploration can include a range of normal sexual behaviors, from masturbation to kissing, touching through the clothes, genital touching, oral sex, and anal and vaginal intercourse. When the supports we need for sexual health are present, namely positive relationships, access to health care, including condoms, and the knowledge, attitudes, and skills needed to protect our health, any of these behaviors can be regarded as healthy. However, when these supports are missing or inadequate, engaging in some of these behaviors increases a person's risks of unintended health consequences. Deciding if you're ready to have sex, either for the first time or any other time, is a big decision that's very personal. If possible, it's important to think it through and consider if you're ready. In a perfect world, it can be regarded as an important decision that only you can make. It can be really helpful to talk about it with someone you trust, like a parent, a friend, or someone else who cares for you, or even a student counselor. For many of us, our first encounter with sex may have been more complicated. It's possible that it didn't come about as a result of an agreement between ourselves and another consenting partner, but rather that we were pressured or coerced into it. Sex before you're ready, and sex with someone you don't trust or respect, or who doesn't trust or respect you, or sex that doesn't feel good, can lead to some really stressful feelings. and sex shouldn't be stressful. Having sex at an early age is associated with a greater number of sexual partners and with having concurrent partners. Youth who started having sex at an early age are more likely to use alcohol and other drugs when they have sex. How important sex is in your life can change over time. People have different sex drives, an urge or interest in having sex. Lots of things can affect your sex drive, like stress, hormones, life experience, illness, medicines, and how comfortable you are in a relationship, how safe you feel, and how attracted you feel to someone else. It's important to think about if having sex is something you really want to do or something you're being pressured to do, whether your family and friends will support your decision and how important that is to you, your feelings about who you are and what you're comfortable doing, whether you want to be in a committed relationship before you have sex, and if it's true for your partner too. What the pros and cons are, and especially thinking through any negatives before making a decision. And sexual attraction. Some young people may be aware of an attraction to people of the opposite sex or the same sex before or early in adolescence, but other young people may not recognize same-sex attractions until later in adolescence or adulthood. Although sexual orientation is stable over time for many people, it may be fluid and changeable for some others. Developing a meaningful sense of one's sexual orientation and identity is an important undertaking during emerging adulthood. A greater acceptance of premarital sex and living together as couples with patterns of delaying marriage has translated into increased opportunities for sexual and romantic exploration among youth. Engaging in sexual identity exploration also goes hand in hand with other prevailing characteristics of emerging adulthood, including negotiating experiences of instability, feelings of transition, heightened self-awareness, and identity exploration. Studies document resilience and positive outcomes for lesbian, gay, bisexual, transgender, or those questioning their sexual orientation, is associated with support to families, teachers, and gay-straight alliances at school. It has been demonstrated that family acceptance has the strongest overall influence on positive health outcomes for young people who may be experimenting with their sexual orientation. Unfortunately, sexual minority emerging adults continue to experience alarming levels of discrimination and victimization. The question of normality. Sexual inclinations and experiences are highly diverse across people. We must be very careful about labeling a certain sexual orientation or sexual practice as abnormal. It's too easy to pathologize behavior which may simply be idiosyncratic. What constitutes normal sexuality or behavior is debatable. Sexual standards and practices relate to culture, religion, language group, and historical context. Take some time to consider the ideas with which you grew up regarding sex and sexuality. What was positioned as appropriate and normal and what wasn't. Often, for someone belonging to a particular cultural group or religion, certain sexual practices might be considered taboo. For others outside of this group, these practices may take on another meaning, or might be regarded as acceptable and normal. In psychiatric circles, healthy sexuality and sexual activity is described as bringing pleasure to yourself and your partner, whether it takes place in a relational or recreational way, and does not feature the experience of inappropriate guilt feelings, anxiety, or compulsion, which is characterized by a driven, automatic feel to the act. What is clear, however, are these two non-negotiable issues which apply across diverse sexual practices and sexual orientations, namely, that coercion of others into sexual activities is not okay and not permissible, and that sexual urges must not lead people into regrettable, dangerous, detrimental, or mutilating practices. Consent. Consent is when a person freely agrees to something. When it comes to sex, consent is mandatory every time. Consent is when someone agrees to do something sexual with you, whether it's kissing, touching, oral sex, vaginal sex, or anal sex. Before doing any of those things, it needs to be totally clear that both people involved actually want it. Consent occurs without there being any pressure or manipulation involved. Asking for consent isn't so difficult, and it doesn't have to be awkward. In fact, it makes doing sexual acts less awkward and less confusing because when there's clear consent, you know for sure that the person you're with would like to do the same thing as you. Consent is freely given. It's not okay to pressure, trick, or threaten anyone into saying yes, and you can't give consent if you're drunk, high, or passed out. Consent is ongoing. It's okay to say yes and then to change your mind at any time, even if you've done it before and even if both you and your partner are naked in bed already. Consent is informed. You can only consent to something if you have all the facts. For example, if someone says they'll use a condom and then they don't, there isn't full consent. Consent should be enthusiastic. When it comes to sex, you should do stuff you want to do, not things people expect you to do. If someone doesn't seem enthusiastic, meaning happy or excited or energized by the idea, stop and check in with them. Consent is specific. Saying yes to one thing, like going to the bedroom to make out, doesn't mean you're saying yes to other things, like having sex. If you ask for consent and someone says no, try not to take it too personally. It doesn't mean there's anything wrong with you, and it doesn't necessarily mean that the person doesn't like you either. Different people have different boundaries. Once the person has said no, stop asking. Don't try to make them feel bad about saying no, and don't try to convince them that they're wrong or missing out. That would be disrespectful. Unfortunately, lots of people don't ask for consent before they start touching, kissing, undressing, or doing other sexual things to your body. Under these circumstances, saying no can feel very difficult. It's normal to worry about disappointing another person or your partner, especially if you like them. But you don't have to apologize or explain yourself. Just saying no or stop is enough. Here are some other ways to say no. I don't like that. I'm not into that. I'm not ready for that. I don't feel like it today. I really like you, but I don't want to do that right now. I'll only do that if you use a condom. Or how about we do something else instead? According to the Criminal Law or Sexual Offences and Related Matters Amendment Act of 2007, the age of consent for both boys and girls is 16 years of age. Of course, there are some exceptions. For example, if both partners are between the ages of 12 and 16, they won't be criminally charged, and it is not criminal for a child under the age of 16 to have sex with a partner who is less than 2 years older than they are. Furthermore, South African law states that no child under the age of 12 can consent to sex, and therefore sex with a preteen qualifies as rape or sexual assault. An important takeaway here, though, is that even if someone is of age to have sex, it doesn't mean they automatically consent to having sex. They can still say or imply no. So there are laws about who's able to consent. If the person you're with is drunk or high, asleep or passed out, below the age of consent or much younger than you, or disabled in a way that affects their ability to understand you, then they cannot consent and it's not okay for you to do anything sexual with them. Negative consequences of sexual activity. This includes infection with HIV, sexually transmitted infections or STIs, and reproductive tract infections or RTIs, and their long-term adverse outcomes such as cancer or infertility. STIs are often asymptomatic, meaning that the infected person often is not aware of being infected. Continued unprotected sexual activity can therefore lead to further transmission. HIV attacks the body's immune system, therefore making the sufferer more susceptible to opportunistic infections. HIV has a long asymptomatic period that can vary between a few years to more than 10 years. This means that people often do not realize they are infected, and this may also lead to increased rates of transmission. When considering relative risk, it's important to remember that even a single exposure to HIV or another STI can result in transmission. Having multiple partners is associated with an elevated risk of HIV and other sexually transmitted infections. Sexually transmitted infections, or STIs, can have a negative effect on sexual health within a relationship. Sexual intercourse can become painful or uncomfortable, as well as there being the risk of transmission. It can also trigger a lack of trust due to the confusion about where the infection came from. If a partner is not informed of an infection, this can lead to unknown transmission, potential legal implications, and definitely a lack of trust within the relationship. Another negative consequence potentially is that of unintended pregnancy. Unintended pregnancies can lead to poor education and a lack of social and economic opportunities for teenage mothers and their babies. Another negative consequence of sexual behavior or activity can be unexpected emotional involvement. Even casual sexual activity often produces intense emotional reactions, even if those reactions are not wanted. Intimate physical contact sometimes generates strong emotional attachments that may be difficult for one or both partners to cope with. For some young people, sexual activity is also mistakenly interpreted as a sign of long-lasting commitment to a relationship. This is simply another reason why good communication between people is so essential before sex takes place. It's also important to note that there may be negative psychological consequences to sexual activity. Poor sexual health can translate into mental health consequences. Safety and informed decision making. Honesty is important in any relationship, but since sex can come with very big risks, honesty and open discussion is especially important in sexual relationships or in the context of sexual encounters. Talk with your partner about risks and how you can make sex safer. If you and your partner have had oral, vaginal, or anal sex in the past, getting tested can help prevent the spread of sexually transmitted infections. Once you know your status, you are empowered to make responsible choices regarding your own and your sexual partner's well-being. If you're having vaginal sex, use birth control and condoms to protect against pregnancy and STIs. If you're having anal or oral sex, condoms or dental dams help to prevent STIs. Talk about how you would handle an unplanned pregnancy or an STI before you have sex. Thank you for joining this presentation.